Have you ever wondered why understanding the management of symptomatic bradycardia is crucial, especially in the healthcare industry? Symptomatic bradycardia, a condition where the heart rate drops below 60 beats per minute, can lead to insufficient blood flow to the body. As a result, patients may experience symptoms such as fatigue, dizziness, or even fainting. In severe cases, it can lead to life-threatening complications. For healthcare professionals, understanding how to manage this condition is not just about knowledge acquisition. It's about being equipped to make critical decisions that could potentially save lives. Guided by the American Heart Association's 2020 guidelines, we'll delve into this topic, dissecting the complexities of symptomatic bradycardia management. We'll explore the recommended therapies and the step-by-step process involved in managing this condition effectively. This is more than just a learning experience, it's a journey towards becoming better healthcare professionals. Knowing how to manage symptomatic bradycardia can be the difference between a patient's rapid recovery or a potentially dangerous situation. The management of symptomatic bradycardia involves a step-by-step process, and we're going to walk you through it. This process, based on the American Heart Association's 2020 guidelines, is designed to provide an effective treatment plan for patients experiencing this condition. The first step is the initial assessment. This involves evaluating the patient's heart rate and rhythm and checking for any signs of inadequate perfusion. These can include symptoms such as chest discomfort, shortness of breath, or decreased level of consciousness. Once the initial assessment is completed, the next step is to identify any reversible causes. This could be anything from certain medications to underlying health conditions. By identifying these causes, healthcare professionals can target their treatment more effectively. For instance, if a medication is causing the bradycardia, it may be necessary to adjust or stop the medication. If an underlying health condition is identified, treating the condition could help to resolve the bradycardia. The third step in the process is to follow the bradycardia algorithm. This is a step-by-step guide that provides a clear path for treatment. It begins with maintaining patient airway and breathing, followed by monitoring vital signs and heart rhythm. If the patient's heart rate remains below 60 beats per minute and they remain symptomatic, intravenous access is established and atropine is administered. If atropine is ineffective, a transcutaneous pacing or dopamine or epinephrine infusion may be considered. It's important to note that while we're following the bradycardia algorithm, we should also be considering transcutaneous pacing and the potential need for a pacemaker. These are not last resort options, but rather, they are part of the integrated management approach. The final step is to reassess the patient frequently. This ensures that the treatment is working and allows for adjustments to be made if necessary. It's all about patient-centered care and tailoring the treatment to the individual's needs. By following these steps, healthcare professionals can provide effective treatment for symptomatic bradycardia. Now that we've gone through the process, let's highlight the key points in the management of symptomatic bradycardia. The first key point is recognizing symptomatic bradycardia. The condition is defined as a heart rate less than 60 beats per minute that also causes symptoms such as fatigue, dizziness, or syncope. It's crucial to understand that bradycardia alone doesn't warrant treatment. It's the symptoms that dictate the need for intervention. Next, we focus on the initial management, which is maintaining airway, breathing, and circulation, or as we commonly refer to it, the ABCs of life support. This is the golden standard in any medical emergency, including symptomatic bradycardia. The third key point is the identification and treatment of underlying causes. This could include medication adjustments, treating hypoxia, or addressing electrolyte imbalances. It's essential to understand that treating the underlying cause often improves the bradycardia. Next, we have atropine as our first-line medication. This drug increases the heart rate by blocking the action of the vagus nerve on the heart. However, if atropine is ineffective, we move on to our fourth key point: transcutaneous pacing and dopamine or epinephrine infusion. Transcutaneous pacing is a temporary measure that uses an external device to deliver electrical impulses to stimulate the heart. Simultaneously, dopamine and epinephrine are catecholamines that increase heart rate and contractility, hence improving symptoms. Our fifth key point is the consideration of a transvenous pacemaker or a permanent pacemaker if the patient remains symptomatic despite these interventions. This is a more invasive procedure and is usually reserved for patients who don't respond to other treatments. The last key point is the continuous monitoring of the patient. This involves observing their symptoms, heart rate, and rhythm. It's essential to keep in mind that the goal is not just to increase the heart rate but also to alleviate the symptoms. Remembering these key points can ensure that you provide the best possible care for your patients with symptomatic bradycardia.